Welcome to our Exercise Oncology webinar series. This is our third webinar for the fall. I believe we have two more after this, so we're right at the halfway point. But again, I just do these webinars because I think it's really important that we try to build a global workforce in exercise oncology, and kind of give you a behind the scenes look at what is happening in the world of exercise oncology and how you can be a part of that. I know on this call today, we have people from Mexico, we have people from Jordan, and we have people from South Africa. And those are just the people that I saw joining already. So it's very exciting to have people from all over the world that are joining us today. Today, we're going to talk about technology and how technology intersects with exercise oncology. And if you're anything like me, I think technology, at least for me, technology is a little bit intimidating. I like to have the latest gadgets, and I like to have like the new iPhone, and I have an Aura ring to track my sleep and all of that stuff. But sometimes whenever I'm learning a new technology, I get a little intimidated and a little bit overwhelmed. But the reason why I wanted to talk about technology and kind of the behind the scenes look at, how can technology help us in exercise oncology is because, whether we like it or not, technology is reshaping almost every part of healthcare, and exercise oncology is really no exception. And we see this with wearable devices, we see this with telehealth platforms, we see this with, data-driven AI and different, models that can predict risk or, even go beyond that and prescribe exercise and various things. And so I think it's important that we understand how to use technology because, like it or not, it's here to stay and it is going to change the way that we deliver healthcare. And so the things that I wanted to talk about today in the webinar really is looking at how technology is supporting and expanding exercise oncology, and what are some current innovations that we can use now in our delivery of exercise, and what is coming on the horizon. And then finally, I would like to talk about how these changes are creating new career opportunities in exercise oncology. And, I think it's important to learn how to work with technology and so that we can use it as a tool. It's not something that's meant to replace humans and human engagement, but we can use it to help us in our work that we do. So that all being said, you know, let's kind of zoom out for a minute as and kind of look at the bigger picture. So, how is technology transforming healthcare overall? And specifically, how is it transforming healthcare in oncology care? So, over the last decade, we have seen an explosion in the innovation in medicine. Patients are now able to access their test results instantly through online portals. I know I have my chart, so I can look in my chart and get all of my test results without having to wait for a call from my doctor. We can do telehealth visits instead of going into the doctor's office. So we can essentially meet with our doctor without even having to leave the comfort of our living room. We also have wearable devices. I mentioned earlier I have an Aura ring. I've used this Aura ring now for the last 4 years. So I have 4 years of data that's stored on this ring, and I think it's very helpful. It can identify when I'm getting sick and when I'm stressed out and when I need to kind of take a breather. We also have Apple Watches that can help track our step counts and our activity levels, and so we are all using technology, and in such a way that like we probably don't even really think about all of the ways that we use technology. When it comes to cancer care, though, I think we see some unique challenges where technology can really make a big difference. And this is sometimes when we look at the barriers that cancer patients oftentimes face when it comes to exercise, oncology, and rehabilitation. The first one is access. A lot of people live far away from specialized cancer centers. I know here in the US, if you're in a rural population, sometimes you may have to drive like 2 or 3 hours just to get to the nearest cancer center. Sometimes people, even if they do live close to a cancer center, they may have transportation limitations, or they could potentially be too fatigued or too immunocompromised to even travel. And so access is definitely a place where we can see technology helping us. Also, sometimes safety comes into play. When we're dealing with patients who are in active cancer treatment, oftentimes they're going to need really close monitoring. So we're going to need to know what is their heart rate, what is their oxygen saturation, what are their symptoms that they're experiencing in order to know if it's okay for them to even exercise safely. And so those are all things that can be tracked with technology. And then finally, scalability. And I think this is really important not to overlook. There's so much momentum right now in the field of exercise oncology here in the US. I do believe by the end of this decade, we will have exercise be a part of the standard of care, which means that the 1.8 million people diagnosed with cancer here in the US are going to need an exercise program. And again, that's just here in the US. I've been saying that we have people from all over the world that are joining us on this webinar series. And so, how do we scale in such a way that we can meet the demand of these growing number of cancer survivors worldwide that want to engage in an exercise program? It may not be possible for us to meet with each patient one-on-one at the hospital. So technology does help us reach more people without compromising the quality of the delivery of our exercise. And I think this is really where exercise oncology can benefit from innovation. So when we use technology well, it allows us to expand access to individualized prescriptions of exercise. It helps us to monitor our patients effectively, and it can even reduce healthcare costs because it can help prevent complications before they even arise. So I think technology really plays a big role in exercise oncology. The important thing to remember is that technology is not meant to replace the human element of care. So we believe at Mapletree that we can use technology to enhance our care and in the delivery that we serve our patients with. So at Mapletree, we often say that empathy and compassion must remain at the core of everything we do, and we can deliver evidence-based exercise oncology programming more effectively when we use oncology. So, technology in healthcare, especially as it relates to exercise oncology, is really about combining the best of science with the best of humanity. It's a tool that, when we use it responsibly, it will allow us to truly provide patient-centered care. So there's three main categories of technology and exercise oncology that I want to talk about. So now that we've looked at the big picture, let's kind of look in more practical aspects. So when we talk about technology in this field, I think it can feel a little bit overwhelming. There's a lot of different tools, a lot of different platforms, and a lot of different devices out there. So in order to make that easier, I like to group them into three main categories. So we have wearables and remote monitoring. And these are the devices that help us track how patients are doing and how their bodies are responding to the exercise, to the treatment when we're not with them. Then we have telehealth and virtual delivery, which are platforms that allow us to bring exercise programs directly into the patient's homes. And then finally, we have data and precision exercise prescription. And this is the systems and the analytics that help us to tailor exercise more effectively for each individual patient. So I'd like to spend a few minutes looking at each of these and looking at what's out there now and what's being used in healthcare and some of the benefits and some of their limitations. So when it comes to wearables and remote monitoring, when I say wearables, I think you probably think of like the Fitbits or the Apple Watches that we talked about, or the Garmins that sometimes people use. And that's exactly right. That's what they are. Wearables are devices that are designed to track things like steps, heart rate, sleep, even heart rate variability and oxygen saturation you can get from these devices. In research and clinical practice, we also can use more specialized devices like an accelerometer or a chest strap heart rate monitor, or even movement sensors that can give us very precise activity data. In exercise oncology, these devices can be very, very valuable, and that is because they give us a window into what is happening with the patients outside of the clinic. So when we're not directly with them, oftentimes we see cancer patients that are struggling with fatigue, or sleep disruption, or reduced activity levels. And by having patients wear wearables, we can track things like physical activity. So we can see directly how much movement they're getting each day. We can look at fatigue patterns. So we can basically look to see if their activity levels drop after chemotherapy sessions, for example. And we can use that to guide our exercise programming. So one of the things that we teach our trainers to do at Maple Tree is periodization training when someone's in chemotherapy. And the way that it works is typically that week that someone's in chemotherapy, we do see a drop in activity levels because of the fatigue, because of the sickness that they feel. And so those weeks when we see their activity levels drop, we bring their exercise intensity down just a bit. Usually we try for about 10% reduction. And then as they get better, the next week we can bring up their exercise intensity level just a bit. And then, in the third week after their treatment, as we see activity levels returning back to baseline, we can bring their intensity level back to where they are. So it's a nonlinear approach to adjusting their intensity levels. And again, that's based on the fatigue patterns that we see when someone's in chemotherapy. So if someone is wearing a wearable device, then you can directly track their activity levels and you can adjust their exercise programming right on the spot. That will really help enhance patient adherence and attendance to their program, which is what we want. We always operate under the theory that something is better than nothing. And so, even on the hard days, there are still some things that we can do. And when patients are wearing a wearable device, we can directly see that and we can accommodate for that in their exercise program. So, I think that's really important. Another thing that we can do is check their sleep quality. So I know with my Aura Ring, every morning I get a sleep score. Now, excuse me, that was right on cue, wasn't it? So I've been sick this whole week. I've been, not feeling great, and I've been traveling. And so one of the first things that I like to do in the morning is look at my sleep score to see how well did I sleep last night, or if I feel like I didn't get a good night's sleep. Sometimes that bad sleep score will almost validate what I'm feeling. So again, we can monitor sleep scores to guide our exercise prescriptions. If we see poor sleep scores, that doesn't necessarily mean you get the day off from exercise, but it might mean that we need to pull back just a little bit and adjust the exercise programming. I know for me, on days that I get a bad sleep score, I like to do my activity outside because there's something about being in the fresh air and being in the sunshine that does help boost my energy levels. So again, we can use sleep quality to track and guide our exercise prescriptions. And then finally, heart rate and heart rate variability are oftentimes going to be tracked on those wearable devices. And this can help us to understand the recovery of the patient and their readiness of exercise. And so, those are things that we can get access to when someone wears a wearable device or a remote monitoring device. A real world example of this I did want to share of a patient that we worked with from Maple Tree who was going through breast cancer treatment. She wore a fitness tracker throughout her program, and we were noticing that her step counts and her sleep quality consistently dropped the day after she received chemotherapy. And so that kind of gave us an actionable data that we could use. And so therefore we adjusted her exercise sessions to be lower on those days where we had noticed that she had the chemotherapy, she had the lower step counts and the poor sleep quality. So we adjusted her intensity to make it a little bit lower, and then in her exercise sessions on those days, we focused more on stretching and on mobility. And as a result, this patient was able to stay more consistent with her exercise program And at the end of her program with us, she reported feeling supported the whole time she was going through the program, rather than feeling like we were pushing her too hard, especially when her body was struggling. And so I think it's really helpful that we can use technology to see how our patients are doing, and we can adjust the exercise program. And that really helps the patients to know that we see them, we hear them, we're going to work with them, and not necessarily against them. We're not going to push them too hard. We're going to meet them where they are. So again, I think it's really important, and you get such valuable data from these wearable devices. Another thing I want to talk about is telehealth and virtual delivery of exercise. So I will say, I didn't know how telehealth and virtual exercise programming would go. So if you would have asked me in 2019, hey, how do you feel about doing exercise sessions via Zoom? I don't know that I would have thought it would have worked. Especially when you look at our typical population that we serve, they're usually, older adults that may or may not be familiarized with technology, may not be comfortable with using technology. I remember when the pandemic hit, I actually did a Facebook Live teaching people how to use Zoom, because it just wasn't really a part of most people's daily life. I had used it here and there for different meetings, but at that point in time, most of our meetings took place in person. And when the pandemic hit, suddenly telehealth and virtual programming were everywhere. And exercise oncology really wasn't any exception when I suggested that instead of closing our doors while the pandemic was happening, I suggested, can we do virtual exercise programming? I wasn't really sure how it would go. I wasn't sure if the hospitals we worked with would go for it. But, we knew that patients couldn't safely come into hospitals. They couldn't safely come into gyms during that time. And so it was either let's give this a try, or we have to close our doors for who knows how long, and who knows if we'll be around even afterwards. And so video-based exercise sessions really did become a lifeline, not only for our organization, but for our patients as well. I think over the course of a weekend, we were able to transition 86% of our patients into a virtual exercise model. And then by the end of that first 12 weeks, I think we were up to 94% of our patients using virtual. And it was just like this. So we would do a Zoom call with them. We can do the exercise programming with them. And oftentimes we would have patients tell us that we were the only people that they talked to during that day, that if it wasn't for us, they wouldn't have gotten off their couch that day. And so it truly did become a lifeline for patients. And now, 6 years later, almost 6 years later after which is hard to believe, it's been almost 6 years. um, Now I would say about two-thirds of our offerings of the people that we serve them virtually. So it really has become something that we use every single day. And you can do the same things on Zoom or on any kind of similar platform as you can in person. If you have a one-on-one session, you can still tailor the exercise program to the patient's needs. You can still monitor them closely. You can still use group exercise classes to build community and build support. So it has been very helpful, and it is something that I think people have really embraced. Another tool that we see is the use of mobile apps for guided exercise programs. So these can provide patients with pre-recorded workouts or instructional videos, or even daily movement goals where they can track their activity levels. I know at Mapletree, we have an app that we use from Smart Health Clubs, and we have all of we have a whole library of exercise videos listed on there, and our patients were able to assign them videos that they can do throughout the week when they're not working with us one-on-one, and they can do the exercise. And on our end, we can monitor what is their intensity level, what was their heart rate. If they had any notes for the trainer that they want to give back to us, we can keep track of that. If they have a wearable device, we can also track their activity through that app. And that really helps us to be able to know kind of where our patients are in the off times when we're not with them, because we only meet with them once per week. And since we've rolled out our app to all of our patients, we give it to them for free for the first 12 weeks that they're with us. we have noticed a 27% increase in functional status and outcomes whenever we measure patients who are using the app compared to patients who are not. So it is really valuable and really helpful for them. Um, and then the last thing I want to point out or just kind of talk about is something called Maple Tree On Demand. And so this is a virtual exercise videos that we have created specifically for cancer patients. I got the idea from this from Beachbody. So I feel like I have to give Beachbody the credit. So it's essentially Beachbody, but for cancer patients. And what we did was we created a library of exercise videos. We have more than 250 of them, and they are tailored according to the tumor type that the patient could have, the side effects that they might be experiencing, and fitness levels. And so low, medium, and high, and they can be completed in the patient's home without any exercise equipment whatsoever. So, for example, if you have a patient that is dealing with neuropathy, we have safe balance focused classes that they can follow. If someone is recovering from surgery, we have mobility exercises that are very gentle that they can do. One of our patients told us that having these options available at home gave her a sense of control and normalcy during a time where she felt so many things were out of her control. So, that's just one of the ways that we're able to use technology to help our patients and to help enhance our services. Of course, virtual delivery does have its challenges. And so some of the things that we see are internet access is not available everywhere. It's not equal to everyone. And so sometimes, you have to deal with that. You also have patients who may not feel comfortable using technology. And so I think that's sometimes we have to help them work through that. And I think for as being a provider, we have to sometimes tailor our coaching style if we can't physically correct them, like say with form or something. We have to be really good at cueing and observing things through the screen to help them. But I would say overall, telehealth really has been a game changer, and it has helped to open doors to patients we might never have been able to reach otherwise. So far we've talked about ways we can use technology and how it's changing oncology with wearables and with telehealth platforms. What I want to do here is look at all of the information that we use. Like look at how all of this information that we get is used, because I think it's important to know that if we have this data but we're not using it, it's not really going to help anyone. And so, data and precision exercise prescription is where we can start to see how algorithms, electronic medical records, and even AI can help us create exercise programs that are safe, that are individualized, and more effective for cancer patients. And so, think about it this way: if we have wearables and we have telehealth that give us the tools to collect information and to deliver care, that's one thing, but I think what really makes technology powerful is how we use that information to make decisions. And that's where data and algorithms come into play. So, using algorithms and AI to tailor exercise prescriptions. In traditional rehab, much of exercise planning is based on guidelines, it's based on clinical judgment and patient feedback, which is important and it's always going to be important. But now we can use algorithms to draw from large data sets to predict how patients will respond. So, an example of this would be we can create an algorithm that might suggest that the safest starting intensity for a breast cancer patient undergoing chemotherapy. And this can be based on their age, their treatment type, their baseline fitness, and their reported fatigue levels. And over time, AI can adjust recommendations as their data changes, which is going to make the program more dynamic and more personalized to that person. Another really important piece of this puzzle is integration with electronic medical records. So imagine your patient's oncology team can see their exercise progress right alongside of their lab results. This is going to be particularly important when exercise is part of standard of care. And so this integration is going to create a much more holistic view of patient care. And it means that exercise physiologists can more closely be connected to the medical team, which is very important when we're looking at things like safety and coordination of care. Some hospitals are starting to explore this. I know at Mapletree, we have our data collection system can integrate with our hospital's EMRs. And so we do have some examples where we are integrated into the EMR systems, and the doctors can see their exercise prescription and make notes on it. But I still think that this is an area where there is room to grow here. And I think as technology develops, we're going to see, and as this becomes more standard of care, we will see this integration happening more often. And then finally, we also have predictive models, which are tools that can identify patients who are at risk for having poor outcomes. So, for example, we can analyze patterns of physical activity, of sleep and symptom management, and we can create models that can flag patients who are more likely to experience fatigue, severe fatigue, or falls or hospitalizations. This can give providers a chance to intervene earlier before small problems can become larger problems. This is also an area that is of interest to a lot of the insurance payers that I've been working with, particularly as it relates to fall reduction. And so I think in the long run, we're going to see that predictive models are going to save a lot of stress and a lot of healthcare costs. So stay tuned as this develops. Of course, when we talk about data, there are some ethical considerations that we do need to address. So the first one is patient privacy. It's very important that the patient data is stored in a manner that is HIPAA compliant, that the people who have access to that data are supposed to have access to that data, but that data is protected. We need to make sure that we are following those ethical considerations. In terms of security, we need to look at what safeguards are in place to protect against hacking or breaches in data. We've all probably been the victim of data breaches in the past. I know a local healthcare system had a major cyber attack a couple months ago that basically crippled their organization for weeks. And so security and having those safeguards in place is very, very important. And then finally, equity. And what we mean by equity is, are these tools designed in ways to serve all population? Or do our data, do they reflect data from all groups, or are they just certain groups? So we need to make sure that the data we have is reflective of everybody. We don't want to build our algorithms mainly on data from younger, wealthier, or majority populations, because they are not going to serve diverse populations as well. And so at Mapletree, of course, we are always looking to expand our reach globally and to serve minority populations in underserved areas that may not traditionally have access to exercise programs, which again is where technology really does come into play. So at Mapletree, we think of technology as a tool, which is something that should enhance, not necessarily replace human care. So algorithms can help us to make better decisions, but they can't replace the empathy, the encouragement, and the clinical judgment that comes from working directly with a patient. So we have seen how powerful this can be in practice. We had a patient recently who was undergoing a stem cell transplant who is at high risk for fatigue and hospitalization. And so what we did at Mapletree was we combined her data from her daily symptom logs with wearable activity data. And we were able to notice when she had a sharp decline in her step count, and her reported energy levels declined about 3 days before her lab values worsened. And so we were able to catch that early and then adjust her exercise intensity. And what we did was we pulled back on intensity. We focused more on breathing, on stretching, on mobility, and we communicated those changes that we noted with her oncology team. And the result was she stayed more engaged in her program and did not have to go to the ER as a result of the decline that she had. So again, this is promising. The promise of precision exercise prescription is is there. We don't need to use data just to track what's happening, but we can also use data to predict and prevent problems before they actually spiral to a point where it becomes more difficult to treat. So, all that being said, emerging and future directions of technology. Now that we've looked at what's currently being used, let's take a peek at what's coming next. Technology is moving fast, probably faster than a lot of us would like, maybe faster than what it feels like we can keep up. But I do believe that there are some exciting innovations that are just beginning to enter the world of exercise oncology. One area is that of virtual reality and gamification. So we work with some pediatric cancer populations, and this is something that I would really like to implement in our programming here because obviously with the younger populations, I know we have a VR headset that my children love to use. Anytime we can add gamification to an activity, I think it's going to be more engaging, especially for younger populations. But essentially, what this could mean is a patient could put on a VR headset and they can imagine that they're walking through a forest while they're completing their balance exercises. Maybe with the gamification they can earn points or rewards for completing their daily activity goals. So essentially these are tools that can make exercise feel less like a medical prescription and more like something that's engaging, something that's motivating, and especially valuable for patients who might be feeling anxious or discouraged with different things that are going on around them. Another trend is the development of smart gyms and connected equipment. So I think Technogym does this very well. Peloton also does this very well. But essentially, what this is when we use exercise bikes or treadmills or resistance machines, essentially what this would do is this would automatically adjust the resistance levels for you. It would monitor your progress. It would send data back to the provider. I believe in the future we could see oncology specific equipment that will adapt specifically to the patient's treatment status or energy levels or even physical limitations. So I believe that is coming on the horizon. But with all of these innovations, I think it is important to be mindful of equity. So remember that not every patient is going to have access to the latest technology. Not every patient is going to have high-speed internet or the financial resources to afford it. And so we do need to be careful to, not restrict access to this, but we want and widen that gap that exists. We need to be continually asking ourselves, how do we make these advances reach underserved populations? How do we design solutions that are affordable, accessible, and culturally sensitive? So I do believe that the future of exercise oncology technology is bright, but it is up to us to make sure that it is also fair as it evolves. Before we wrap up, I do want to talk about what all of this means for you as a future exercise oncology professional. Because technology isn't just shaping how we deliver care, it's also shaping the kinds of careers that are available in exercise oncology. So, one potential path, is that of a clinical exercise physiologist who integrates telehealth. So, many hospitals and cancer centers are beginning to offer virtual sessions alongside of in-person sessions. So, as I explained earlier, about two-thirds of our service delivery model is delivered virtual. And so, clinicians who are comfortable leading sessions over Zoom, who are comfortable monitoring patients with wearables and documenting outcomes in electronic systems, you're going to be in high demand. And so, I would familiarize yourself with these things and be learn how to do them so that you can potentially have this career where you're using technology. I think another area is research in digital health interventions. And so what we see with that is universities, cancer institutes, and even sometimes private foundations are funding projects to test how technology can improve patient outcomes. So if you're someone who enjoys data, if you enjoy designing studies or publishing research, there's definitely a growing opportunity to be a part of clinical trials to evaluate telehealth or wearables or even AI-based exercise tools. So definitely be on the lookout for those. And then finally, there are also industry opportunities. And we see this with fitness and health tech companies that are looking for exercise scientists to help design apps, validate wearable devices, or ensure that exercise recommendations are evidence-based for special populations like a cancer survivor. So your expertise could help shape the tools that thousands of patients end up using. So all of that being said, as you step into these roles, I think there are some specific skills that you can take some time to help develop. The first is data literacy. So being comfortable with working with numbers, being comfortable with interpreting graphs, and understanding what algorithms or wearables are actually measuring, I think is going to be very, very important. I also think telehealth etiquette is very important. And so knowing how to communicate clearly, how to cue effectively, particularly when you're not in the room with someone, you can't use your hands to adjust them. You have to be able to talk them through different adjustments is going to be very important. And that ability to build rapport through a screen is very, very important. And I will say, in my experience with college students, that tends to be something that is lacking. I think there's a lot of more casualness that we see over the screen than what we would in person. And so I do think that it's important to be able to develop a rapport and to present yourself professionally, even when you're across a screen from somebody. And then adaptability, I think, is really important. And really what I mean by that is technology is going to continue to evolve. And I really believe that the best professionals will be the ones who can learn the new tools quickly while keeping patient care at the center. I think that's going to be very, very important. And just in closing, I think one of the most exciting parts about this is that this field is wide open. The field of exercise oncology is still relatively young. And when you add technology into the mix, I really do believe that there are endless possibilities for innovation. So whether you see yourself in a clinic or in a research lab or even working in the tech industry, your skills and your passion can really make a big difference in the lives of people. So we've covered a lot today, everything from wearables to telehealth to AI and to the future of smart health gyms. So I hope that you're walking away with just a more clear picture of how much opportunity there is at the intersection of technology and exercise oncology. If you are interested in learning more, again, please follow us on our social media platforms. You can scan those QR codes for the YouTube channel where we will have this and other webinars that we have done posted there. You can follow us on Instagram or on TikTok, but we're here to serve you and to help you. Again, just to work in this field and to serve more patients.